Thank you, and welcome to the July, well, I should say 14th edition of Quarantine Chats. Thanks everyone for joining on here. As we get started, I want to say hello to everyone who's joining us on YouTube and Facebook and such. And please do remember that you can join the next one, get your questions answered live. There's a convenient link on the homepage of our website, and it's just a couple clicks to get in, free to register, very easy to get in through there. The agenda for today is similar to the one that we always run through for Quarantine Chats. We'll start off with a little bit of the news, and then we've got a topic for discussion, which today is about managing teams through some of the tricky areas of COVID management, privacy, safety, discrimination issues, navigating all those tricky things. This is meant to be hopefully an interactive session. So as we all join here, if you wouldn't mind opening up the chat window, and if you could set the to setting to say all panelists and attendees, and then maybe as we get started, just type in a quick hello and where you're coming from, perhaps, or maybe if there's something very specific that you wanted to get out of this, maybe say something about that, just so that we all know who you are and we can say hello. There's also the ability to type in using the Q&A function that's up in the top part of your screen as well. And we do encourage people to come on microphone as well. So if you want to come on and talk about something that's specific, that's easier to do that with your voice, then we'd love to hear your voice too. The more voices, the better on these kind of calls. So speakers today will be two Ians, one spelled the right way and one spelled the wrong way. We'll let you decide which is which. I'm the founder of Entreflow Consulting Group. I've been at this since 2012 and have been doing these quarantine chats since the COVID crisis really kicked off back in late February, early March. I've had the privilege of working in small organizations and large ones. So the smallest being one person, which grew a couple of those up to in the tens of people, and worked in large companies too, large enterprise software companies in particular, and have experienced a lot of HR management and policies and attempts at doing things right. And we're in a whole new world here. So I'm really happy to have Ian Bell on the call with us today. And Ian, if you wouldn't mind saying a few words about yourself, your background, let everyone know who you are.
Well, I'm a kid from Burnaby who, after working for the local phone company, went down to California and joined Cisco, which led to founding a startup, which is called RingCentral. It's the world's largest small business phone service. Eventually returned to Canada and have done a number of fun startups like Tingle and RosterBot, and presently pioneering enterprise health management with Darwin Labs, product we're currently calling Guardian.
Very cool. I've actually used RosterBot, so it's really cool to be connected with the person that put that together. And I also noted RingCentral on your profile. How are you involved with them?
There's three co-founders, two Russians and a Canadian, and I represent the Canadian echelon.
Very nice. I've also used that technology too. So there you go. I'm sort of a fan. All right. I'll introduce our company as well for those of you who may not know. We're a boutique accounting and consulting firm that we work specifically with growth stage companies, particularly in Canada. We do CFO services and all the stuff that CPAs normally do, with a real focus on technology and systems. Perhaps unusually for accounting firms, we also offer HR services. And so we have an HR practice manager, and we can do recruitment and that sort of HR manager type service. And again, with focusing on systems. And then I'm the odd duck. I have a marketing and business development background, so I offer some of those services too. So if you're this kind of company, we're happy to help you with any of these kind of needs. Just give us a call afterwards. Also joining us on the call is Colin Weston from Startup Vancouver, and by extension, Startup Canada. Colin, do you want to say hi and introduce yourself?
I will. Thanks, Ian. Good to see everybody again on QT Chats. I like the way you've shortened the name from Quarantine Chats, because I kept misspelling that with the hashtag, so I appreciate that. For those of you that don't know me, my name, yes, is Colin Weston. So I'm the community leader for Startup Vancouver, which is one of over 40 chapters of Startup Canada across the country, and we are the voice for the 3.5 million entrepreneurs that we have here in Canada. And not only do we have the honor and the pleasure to co-present and co-host events like this with EntreFlow, we do this across Canada and present our own events too. With today, we have After Your Show. We have our latest edition of What Keeps You Up at Night, Entrepreneurship During Challenging Times, Surrey edition. So we're going to be showcasing some fine entrepreneurs out of Surrey. And then next week, Ian, I think you know, we have our second edition of our storytelling event, which is now Can Startup Stories, where we're going to be celebrating Black entrepreneurs. We're going to have
Colin froze for a second there, but celebrating Black entrepreneurs is what I heard. You froze up for a second there, Colin. If you wouldn't mind putting the links in the chat to those events, then people can join onto that. It would be great. Last but not least, a last-minute addition to this edition of Quarantine Chats, but a regular on the early series is Dustin from our friends at Payment and Evolution. You want to say hello, Dustin?
Absolutely. Thank you for having me. It's been a couple of weeks since we've seen each other here, so it's good to see Colin, good to see Ian, and again the other Ian with the right spelling name. Yeah, hopefully all is well. We're missing you. We're here all the way from Toronto, here in Ontario.
Shots fired, Dustin. Shots fired.
That'll come back to bite you. We'll see. All right, let's do the news. So we've got an announcement that came out yesterday. Prime Minister Trudeau announced that the CEWS, the Canadian Emergency Wage Subsidy, would be extended until December 31st of this year. So for those of you who may not remember the early days when we were talking about this, that's the so-called 75% wage subsidy, eligible for businesses that employ workers and have experienced a revenue drop. We are still waiting for additional details on if the eligibility criteria are going to change for this. The currently posted eligibility criteria are the same as before, and they're referring to the open period, which is period 4, which requires a 30% revenue drop between either the average of January and February of this year or the same month last year. So something might come up there, but it looks like claim period 4 is now open as of just after last QT Chats edition. Dustin, have you heard anything else about this?
No, we've heard the actual announcement at the same time that we heard everything, kind of be announced by Justin Trudeau. The simple answer is no, that we haven't heard any other information. But just for those who are on the chat here with QT Chats, Payment Evolution continues to be able to, build the reports necessary so that you guys can apply for those EWSs. So, as a payroll company, it's important to be able to have that. And if you don't have that currently with your current payroll, then let us know. Maybe we can be of a help and help you out a ton, right?
Yeah, very good. It was interesting for me to hear the uptake on this program was a lot lower than expected. And they actually cut the budget for it a little bit initially because people weren't taking it up. But it seems the feedback from the business community was that it just took a while for everyone to go through their payroll records and get everything organized to submit applications. So that was an interesting thought there. Hopefully people are in order, and you know, if you need help, obviously ourselves can help, or payment evolution technology can help as well.
Yeah.
So
kudos to you guys, because actually a lot of our clients, because we work hand in hand in partnership with you guys, you have been, you know, Entrepreneur has been able to be right on the ball with everything, and we're noticing that a lot of the clients that come from the overall relationship have been able to take advantage of those, you know, CEWS reports that we've created on the fly. Like, these things were created by our dev team literally within 24 hours of it being announced, and it's been helping out a lot of those clients. So for those who have not been taking advantage of it, just so you know, like, you know, let's talk to, you know, our team here. We're offering all the help that we can provide, as well as I know you guys already provide a lot of that help for your clients as well that are on it.
Okay. Super good. So, well, as those new eligibility criteria come out, then tune in here and we'll have more details about it. Of course, if you have questions about it, then bring them up here. I always like to include some positive news, and I heard this one, which is happening on Vancouver Island, and it appealed to me because it was organized, at least in part, by an angel investment group out in Campbell River. And so they responded to the call to produce PPE, and they had to figure out supply chain and stuff like that. It's a really cool story for what a small community can do to banding together to solve a problem. So I've got the link here, and we'll share that out afterwards. And just sort of a little inspiring story. We've seen a lot of these kind of things where people are figuring out how to produce PPE at the last minute and figuring stuff out. So that's another cool one coming from pretty close to us here. Okay, before I go on, did I miss any news? Anyone else on the panel find anything or see anything that they wanted to share? Slow news? Okay, all good. Let's talk a little bit about employee health, and I'll kind of tee up the topic here, and then I know that Ian has some slides that he wants to share through. But I was thinking about three angles on this. So one is discrimination. So there's legislation around discrimination in the workplace, employee discrimination. So it's important for employers to understand what those things are. So let me just paste that into the chat. And it covers things around discrimination, of course, based on ethnicity and gender, age, these sorts of things. But importantly, it also covers things like fitness and disability. So we're touching on areas where somebody may be differently able to work based on pandemic conditions. And it's important for employers to understand how and to think about how their actions around the opportunities for advancement within the organization, maybe that promotion is up, and who are you going to give it to? Maybe it's the compensation, so who's eligible to get a raise or work those great shifts that pay a little bit of extra if they're on hourly, for instance, or maybe earn some more bonus for doing certain activities. That may be different depending on somebody's health status, and how are you handling that? It's kind of a tricky thing. And there's certainly aspects around giving preference to certain, those nice juicy shifts, if it's sort of shift work, or maybe giving preference to certain people based on working hours or working locations. And denying other people that ability. So how do you handle those things? And certainly when there's the COVID conditions going on is very important. The next kind of thing that balances against this, I think, is privacy. So once again, there's a link that I'll post here, which is about employees' right to privacy. And we have, employees do have a right to privacy, and certainly there's thinking out there, words written about how employers should handle things like tracking an employee's GPS location, tracking an employee's online activity, and there's documentation and guidelines given to employers about that. There's not specific guidelines along these lines about somebody's COVID status. I think it's too early to have that kind of legislation out there, but certainly it fits into the right to privacy conversation. Maybe if somebody has a COVID positive test, or even a COVID negative test, or just different kinds of concerns around that. Maybe they have a relative who has a health concern, and that's not the employer's right to know. It's not the employer's job to disclose that kind of information. That's something that sort of could be personal to the employee. But how does an employer manage or take action without violating somebody's right to privacy? If, for instance, a person is required to take certain actions, work from home or not, that kind of thing. How is that done, and how is that potentially communicated to the team without infringing on privacy? And at the same time, you've got to handle all that privacy and anti-discrimination thinking while thinking about the safety of the whole team. If you can worry about getting sued for discrimination, but you could also worry about getting sued for letting an outbreak happen at your company, right? This is bad. People could die if you don't. I hate to be doom and gloom here, right? But if you're a large team and you're not taking the right actions, if you're not handling safety appropriately, then that's a problem. So, and that kind of seems like it goes counter to the right to privacy and the discrimination thing. So it's interesting to think about, how do we handle this? So, certainly employees have a right to refuse unsafe work. And as employers, if we're wanting to keep people safe, then we're going to need to have some information about those employees, some that may be personal, private information. And we're going to have to do contact tracing of some kind, or monitor people's locations and activities in some way. And we may not be set up to do that in a way that protects the employee's privacy and considers discrimination. So that's me rambling on about this impossible problem that we've all got. And I wonder if you've got a question about this specifically, or a scenario that you're working through, without, of course, divulging a particular employee's situation, but maybe talking in general terms. If you would like to hash that out, or put it forward for discussion, it would be great to hear. So you don't have to do that right now, but maybe as the conversation unfolds, type something into the chat, or maybe raise your hand, and we can talk through some of these sticky situations. I'd love to hear some sticky situations that people are trying to figure their way through right now. Okay, so having sort of introduced that topic, I'd love to hand it over to yourself, Ian. And if you want to share your screen and take us through some slides that you'd prepared, thinking about these sorts of topics. And I know Darwin has some technology that you've started to put out there to help employers deal with these kinds of things. Do you want to go ahead and share your screen?
Mm-hmm. Yeah, here we go. Just taking the presentation view here. Everybody see that? Or are you still looking at me?
Yeah, we're seeing a happy looking dog.
Okay, so yeah, I just quickly added this slide because someone's feeling particularly rambunctious this morning. So apologies for any barking you hear in the background. This is the source of that barking, or more specifically, the FedEx guy is probably the source of the barking. But Anyway, I wanted to talk today a bit about what we're doing and the climate into which we're creating a product, which is obviously compelled a lot by COVID-19 today. We're pioneers in a category with a product called Guardian at the moment. The category we're calling enterprise health management, and it's a much more proactive stance on managing health in the workplace, and we're building a software platform that kind of steps up to that mantle. So, are we lagging here? How come I can't? Oops. We're right in the middle of COVID-19, and it's very difficult to find decent quantitative analysis of the COVID-19 situation because we know so little. But we can draw allegories from existing forms of illness, particularly viral illness. And so I always look to the common cold. The common cold costs US businesses about $40 billion a year, both in terms of lost productivity and actual healthcare costs. And one of the reasons why this is so successful at disrupting organizations is because of a workplace culture that really doesn't respect viral illness. So in a poll recently, actually from 2011, 83% of people that were surveyed reported attending work or school with flu-like symptoms. They're not respecting. We have a culture that actively encourages and rewards people who tough it out and muck it out and come to work despite illness, without respecting the risk of people coming to work ill, which is primarily that they make other people ill. And so that is one of the larger forces at work in affecting workplace productivity today. And you can just imagine how this protracts to more lethal illnesses like COVID-19 or even influenza. So according to the World Economic Forum, hey, where's my frog here? We're kind of like a frog in boiling water. So this is a threat that creeps up on organizations, or has done slowly. And then you have a sort of a signal event like COVID-19 that causes people to actually think about change. But the greater problem is the general idea of workplace illness, pandemics, epidemics, just general viral illness like the flu and the common cold. These cause economic losses that are real. The World Economic Forum talked about 0.7% of GDP, which is not that much lower than the yearly impact of climate change. So it is a compelling force. It's something we don't respect enough. Here, as a comparison, are the numbers around climate change versus influenza. So direct costs from influenza, $90 billion. Those are largely healthcare costs. But lost productivity, mortality, and other costs, supply chain disruption from influenza pandemics, still a very viable and comparable amount. And so I think what is happening is COVID-19 is certainly an event that has to be addressed directly and confronted in the immediate future, but it's also causing people to evaluate how organizations contend with the impact of illness in general, particularly viral illness. So again, the World Economic Forum talks about business on the front line of an evolving microbial war. So it impacts them in a bunch of different ways, including obviously direct impacts on their employees, disruption in the supply chain, and of course customers. If people are sick or if a business is perceived to be a spreader, then footfall drops, sales drop, and revenue drops as a direct result. A funny example is that Kia has produced a really cool SUV called the, oh God, what's it called? Anyway, it's their large 7-passenger SUV. Massive popularity. It's produced in North Carolina. It starts with a T. They cannot sell enough of these. One of the reasons they cannot sell enough of these is because A, their production line was shut down when the state shut down workplaces. And then when the workplace was spun back up, they couldn't start production right away because the supply chain was completely disrupted. So they couldn't get all the parts they required to do assembly. And so they've got, I think the average amount of time one of these vehicles sits on the lot right now is about 5 or 6 days. And they're selling at a $20,000 premium to their original MSRP, simply because just supply cannot meet demand. I mean, that sounds like a great thing if you work at Kia, but really what it is it's money on the table, because there's more people who want their vehicle than they can supply. And the reason they can't supply it is COVID-19. So it can really damage an economy, it can damage an industry, and it can damage a specific company. So one of the things the World Economic Forum talks about is we need a new framework to understand how we communicate the effects of epidemics. That's from a governmental level. It's also from an organizational level. And I think that it requires a shift in leadership mindset. So it requires the HR department and overall leadership to take on a whole new set of metrics and a whole new set of processes and tools to manage the risk of the spread of infectious disease within organizations. So we're talking to some of those tools today. I'll be honest with you, there's not a lot of software out there that really makes this scale well. And the organizations that have taken this on, and there are quite a few that are pretty enlightened about it, but the organizations that have taken this on have really done a lot of pioneering work and spent a huge amount of money to try and be able to navigate these things. So, we skipped the slide again. So, as I said, we're rethinking what the HR department does, right? You want to enlist the company and empower people, the entire organization, to take ownership of management of health. So there's a bunch of different steps that we outline as part of that. Some of this comes from the World Economic Forum. Some of it we've learned in the marketplace. But you know, taking ownership of preventive measures, which I think is kind of obvious to a lot of companies, is really key. You're mitigating the risk of exposure within the workforce. You obviously don't want to expose customers. You have to be, as an organization, really up on what's happening globally that might impact, you know, your supply chain. If you've got supplies coming from China, if your customer base is in Europe, but your manufacturing is in the US, you now span 3 continents in terms of your overall exposure to global threats. So how do you track that? Then you're tracking the emergence of actual illness starting to spread within the company or within supply chain. You're containing outbreaks as they start to happen within your workforce. How do you address that vis-a-vis privacy and human issues? And you know, one of the important things is, which is less true in Canada, but you have to be really proactive about providing care and giving advice to protect staff, not only staff, but staff and families, because of course, families are how a lot of these diseases spread. I play hockey, and I swear to God, I get sick every time one of my friends' kids gets sick. So prevention is pretty basic stuff. Inoculation programs. There was a study in Brazil. A company about 5,000 workers spent about $40 a year per worker on inoculation and vaccination programs, and calculated they saved about $90 a year in lost productivity. So that's a net gain. I think those numbers would be substantially different in the US and Canada, and the US as opposed to Canada, but we have seen very little actual analysis of the effect of programs like that. But it just is kind of a no-brainer. It's relatively inexpensive, especially in Canada, to get a nurse in and administer vaccines, flu vaccine, things like that. Health checkup programs. So these are programs that proactively encourage employees to go visit the doctor and track that. Disinfection programs, obviously keeping workplaces super clean. PPE stocks. I think a lot of people were surprised to discover that Facebook actually had a stock of 100,000 N95 masks. Why the hell do a bunch of programmers need N95 masks? But this is just an example of preparedness. And health and medical benefits. Again, this more speaks to the US audience, but also in Canada, extended medical prescription care coverage is a really important add-on to the care that we get from our government. But in the United States, optimizing the healthcare provider for prevention, not just management of disease, is really quite important. Unfortunately, you find a lot of the healthcare providers in the United States are not particularly proactive and very much optimize their work to maximum billing. And that's a challenge in this kind of environment. Mitigating exposure risk, obviously a whole new set of policies need to be created within just about every organization, right? So visitor policies, asking questions about someone's recent illness or exposure to infectious disease as they come into the company. How do you do that? Employee travel policies, restricting travel to places that are known to be centers of outbreak. And also just restricting length of travel and things like that, or short quarantines, work from home periods after intercontinental travel. Procurement policies, so holding suppliers accountable to report and disclose outbreaks, illness, et cetera, in their workplace, things that might expose your employees to risk. Having a solid and clear employee sickness and remote work policy. In other words, changing the culture from what people do today, which is try to muck it out and demonstrate their admirable sense of workforce dedication by coming and infecting all of their coworkers. You really need to address that through a policy like this. If it's possible for people to work at home when they're a little bit sick, then 100% they should be doing that.
We had a question on the line about that, actually, about organizations with a general policies that only provide 2 days of sick days. So I guess this is along the lines of how do we stop that culture of toughing it out? My answer to that would be, well, increase your number of sick days, or just make it unlimited number of sick days. So that people don't think that they're metered and they can only use them sparingly. So it better be something really bad. So I'd say that, and then work from home policies, certainly very good. And I think generally encouraging people to, if you notice that somebody has symptoms, is to encourage them to go home, right? Mm-hmm. And perhaps some organizations are proactively, as you come in the door, asking, how are you feeling today? There's certain limits to what you can do if somebody responds, I'm not feeling super great, which comes back to that privacy and discrimination thing. But certainly it's one step is to ask the question. And if you missed it, we had a QT chat around this whole topic of how to build policies for exposure risk and mitigation and management. So that was a couple weeks back, and I'll make sure that we post a link to that one in the chat for this one, so that you can go back and watch that recording if you want.
I'll give you a really practical example. At Cisco, I don't know if this is still the case, but 20 years ago, they had a flex work sick vacation policy. So you got 20 days a year, and if you could use those for vacation, or you could use those for illness. And I guess that means you could be sick 20 days a year, but then you wouldn't get any vacation, or vice versa. So of course, what happens? Everybody shows up to work to maximize their vacation, even when they're sick. So you got people dragging themselves in with God knows what illness, and spreading that around the office. And I think that in retrospect, a policy like that actually encourages the spread of disease within the workplace. And hopefully it's something Cisco's reevaluated by now.
For sure. So it's like Helen is asking about, isn't asking the question at the root problem with the privacy. So yes, I think it is. But I think that's where we're going with trying to gather some information somewhat anonymously, and having people sort of self-report in some way. And I don't know how that's achieved, but I think Ian has some ideas on that.
Well, yes and no, right? And an employer has a right to know why someone is sick if they're absent. So what we're talking about is reorienting that discussion. But obviously ethics prevail here, but there isn't a specific policy that contemplates what we're talking about doing now. So that there is no, for example, if I had diabetes, my employer has no right to know that. If I have pneumonia, my employer definitely has the right to know that, because it's probably preventing me from coming to work. So I think what we'll see is a rewriting of law, but before that, a rewriting of practice in terms of how we address this. But we're trying to design a product around, what's the most ethical way to address this, because frankly, a brief survey of North American labor law doesn't really yield anything insightful in terms of how to contend with the issues we're facing today and going forward. So obviously, in terms of mitigating exposure, you're talking about putting equipment in place in some cases, or staging it so that if a large outbreak occurs, you can protect customers. Most of us have probably noticed the shields that are up at major retailers. I was walking past a Zara store yesterday, and all of the sales staff had full face shields and masks and everything. It looked pretty hilarious. But and also an overlooked thing that's pointed out by the World Economic Forum is insurance and risk management strategies. A lot of companies have business insurance that doesn't contemplate continuity in the face of health risks. It's certainly something that is almost definitely going to affect companies again and on an ongoing basis in the future. Risk management is really the discussion around what the points of exposure are within a company, and understanding those in advance of the fact. So World Economic Forum is really recommending proactive discovery on that. Staying abreast of global threats. I mean, it sounds easy, but it's hard. How do you know what all the impacts are that might potentially affect your organization? What's your organization's footprint? How do you monitor this? How do you handle reporting on these threats? I mean, does it become a part of a daily briefing for the CEO? Does it become something that just stays within HR until such time as it escalates beyond where the company has to start taking proactive action? How do you access policies that are being published and disclosed by relevant health authorities? I'd hate to have to sit and watch every single one of these daily health authority briefings all across Canada. I like watching Bonnie Henry, but I'm kind of done with the Ontario ones and the Alberta ones. So just the process of doing that is something where there's a clear gap within organizations. Again, just me nuts. Intra-company threats. So this is how do you surface a threat as it emerges within a workforce? Is there an electronic way in which you can, if a cluster of workers starts phoning in sick, does that mean there's an outbreak among that group? Do you have the level of disclosure, as I was talking about before, with suppliers, so you understand when their own illnesses, outbreaks are going to disrupt the supply chain? And is there risk of that illness transmitting to your organization through the supply chain? Do you share proactively the outbreak of illness within the workforce? Are you worried about scaring them? Do they have the tools to parse this information and take action themselves to help prevent it? This speaks back to preparedness within the organization for sure. And then, once a health authority creates an order or something you're compelled to or have to comply with, how do you put that into place? Big challenges. And then an outbreak happens, right? So you get afflicted by an outbreak, and now it's time to take all those policies that were planned and put them into place. How do you, if you've got a 20, 30,000, 40,000 employee workforce, how do you scale the management of an illness across that workforce? This is where software probably has to weigh in terms of making that viable. One of my questions is, does a line worker at General Motors have an email address at General Motors? How does the company communicate with that worker with regard to their health? There aren't a lot of tools, frankly, today in place. They call them, the supervisor calls them. There's a highly distributed ladder of management that drives that sort of a process, and it doesn't work very well. It's not very timely, and it doesn't scale very well. Isolating affected groups. Again, if you have an outbreak within a specific team, maybe it's best to quarantine or isolate the entire team. Deploying PPE and other protective equipment, how do you roll that across the organization? And then, of course, the big one is restricting building access. Maybe you close an entire building. Maybe you close an entire production line. Maybe you close or force everybody to work remotely if they can. Proactive care for families. I think this is often overlooked, and I think it's important to really understand that a lot of illness moves into organizations through families, and in general, in the United States, family medical coverage is really weak, and this is a time for companies to reevaluate that expenditure, because by saving money on medical coverage, they're probably costing themselves in terms of productivity and medical care down the road. The more people seek out medical care, the higher your premiums, and the process just snowballs. Workforce education in terms of at-home practices. How can I, where I've got kids running around in playgrounds, going to school and hockey practice and whatever else, and managing the risk of the other people in my family making me as also a worker at a company sick. Granting work from home and parental sick leave. So parental sick leave is really key, because if people are trying to juggle managing a sick child and coming to work, they're probably going to fail at both and bring a disease back to the office. So in terms of disease risk management, I'm looking at the World Economic Forum again. They kind of categorized it into 3 columns: passive, active, and advanced. On the passive, obviously, that's what most of us do today. We're frogs in boiling water. We wait and see, and hopefully we are nimble enough to react effectively. That's generally not the case. There's no idea of strategic threat management, and the board and management aren't tracking employee health and productivity in this context as a bottom line objective, and that's a big problem. So active management is you've got better insurance, I guess. You've got some basic response and continuity plans. At least the board and management are starting to pay attention to this. And then advanced organizations, and there are a lot of them out there. There's board level leadership in terms of health management. They're doing active threat surveillance. They're looking at their supply chain. They've got continuity plans. They know how they're going to respond to an outbreak. And, especially in Canada, this idea of engagement in public and private cooperation as a risk mitigation strategy is huge. And then training. So actually taking people aside, whether it's half an hour a month or providing reading materials or whatever, just getting people engaged in discussion around actively managing illness in the workplace. I think there's this is an advanced column company would be a company that's actually working to change the culture around illness in the workplace. And I think that is the overarching theme of what we need to be doing to actually mitigate the spread of illness in the workplace. Helping people understand that self-sacrifice is actually staying home. It's not coming to work. Spreading a disease among your coworkers is the least self-sacrificing thing you could do. So just shifting that culture is really huge. So emerging out of this are a bunch of challenges, right? So as you start to know more about your employees in terms of their level, their illnesses, their health history, things like that, it increases the privacy burden and the data governance burden for the company. So you have to ensure that this data does not leak. And so we've got lots of technologies emerging in the category in enterprise software now for doing identity and access management. And most of those platforms are quite heavily oriented around compliance and safe storage of user data. And so that becomes a key requirement as the depth of information grows. Proactive disclosure and permission, that again is a component of compliance. So helping employees understand what's happening with their information, getting their permission to use their information for this specific purpose, and then adhering obviously to that policy and not using it for other means is quite key. In some cases, what we're doing at Guardian is allowing employees to anonymize their health information until such time as that data is required to manage an outbreak. There are a bunch of legal issues with employee health, as we talked about earlier. It's a pretty murky environment in terms of this idea of employees proactively disclosing their health status as a means to mitigate the impact of illness on the workplace and viral spread within the workplace. So what you won't find is a lot of labor policy in terms of that. What you will find is very specific language in most of the labor codes around an employee's obligation to disclose the nature of their illness, or at least the employer's right to determine the nature of their illness, either through a doctor's note or something like that. You don't even see a tremendous amount of protective measures around employee health information confidentiality enshrined in law, which is surprising. But it is practice, and employers generally shouldn't know about things like chronic illnesses or things like that, because it could potentially become an object of discrimination. So
there was a specific question about mental issues, PTSD, OCD, autism. My initial reaction to that is that the employer doesn't have a right to know that. But maybe I'm wrong there.
Yeah, they don't.
No, a complicated one I think is maybe something like a asthma or a respiratory condition, which can complicate things when, say, a COVID outbreak happens, and how is that related, or how would you want to be treated if you knew that you had this condition? Would you want a different treatment in terms of disclosure if you had that from or to your employer? And it looks like William is saying that there's legal work done on this when HIV was first a big issue. Very good point. Certainly that's an autoimmune disease and could put people at risk to a lot of other things.
From an employer's perspective, so HIV use, well, it's still relatively expensive to manage, right? Any chronic disease with a lot of drugs involved, even diabetes, heart disease, the drugs that manage those diseases are relatively expensive. So you can see why certain employers might choose, if they had no encumbrances, might choose to not want to hire someone who's going to have a strong impact on their healthcare premiums. So that's a very good reason for that not to be disclosed within the organization. I think that it's possible to surf the line between knowing what you need to know in order to contain outbreaks and to keep the business going. Obviously I'm not going to give someone heart disease if I go to work. Although that's still kind of possible, but unlikely. So it's not necessary for me to disclose that as part of the course of working. Mental illness tends not to be contagious. It's not necessary for anyone to know exactly what's going on there. I find it in practice, though, a lot, and I've been through this issue as an employer and as an employee. People with mental health issues, if they do proactively disclose this to the employer, and then somehow they're terminated, they've got a very effective legal case against that employer. So, I mean, what happens in practice versus what's enshrined in law sometimes is a little bit different. But it's, again, we're writing the law, we're writing precedent, setting precedent right now in terms of all of this stuff, and nobody's got it figured out.
I really like the concept that I think you're alluding to, is if I have an underlying condition, say I have asthma or I am pregnant or something, I can proactively and anonymously somehow disclose to the employer that this is something going on for me, and should an outbreak happen, that I want to be the very first to know if there's anything at risk. Then I can, I'm, even if it's threat level 3, I can go, yep, you know what, I'm just going to take it safe. I'm going to stay home if I get that information proactively.
Yeah, that's a very good point. And, I guess if you have a pregnancy outbreak within an organization, you've got some bigger problems on the HR team. But this is a fun time to be looking at this, because we get to set the strategy, broadly speaking. So it's a very exciting time to be working on this stuff. One of the big challenges with this, with a program of this nature, is getting all the employees to buy in. I don't have any silver bullets for that, right? But obviously, the success of any sort of workforce management strategy is the participation of every single employee in the organization. If people don't participate in proactive disclosure, for example, if they don't start reporting their status, then that becomes a real challenge, and the effectiveness of the program diminishes substantially. So you really do need to give employees confidence in this program and educate them as to the objectives of it. There's always going to be a certain element that suspect that there are ulterior motives here, but helping people understand that this is about protecting them and their families as well is hugely important. And of course, making participation easy is really key. and frictionless is one of our objectives as a product company. Compliance monitoring, so keeping track of how the organization is performing, having effective communication tools so that you can surface things within the organization. You know, companies where 100% of the staff use Slack are obviously at an advantage in this kind of environment, because you can do notifications to 100% of the employees with a single action. Notification is a really, really key thing. Again, we live in a world where if a teacher phones in sick, if a teacher is sick, I just blew my own punchline there. But if a teacher is sick, she has to phone her vice principal at 7:30 in the morning, and then there's a mad scramble over the next hour and a half to get a substitute. And the company and the school board has a whole set of rules around which substitutes they can call in which order and all that stuff. And it's just shocking to me that this still happens manually and there isn't some sort of solution in place for this. You know, organizationally, communication tools are an important precursor for effectively managing this sort of thing. So a bit of a commercial about Guardian. This is a pretty amorphous product at the moment. We're very much in the early stages of development. We haven't announced it yet. In fact, you're among the first people to actually encounter this. But it's a software platform that comprises an app and a software platform and a management tool to help manage illness in the workplace. The goal is to prevent the spread of viruses, detect threats as they happen so that you can keep running your business smoothly, or as smoothly as possible, respond rapidly as concerns arise, and then proactively manage employees' health so that in general your workforce is healthier and diseases don't happen as often in the first place. So we create some self-reporting tools. You know, it takes the form of an app. Not everyone's going to have an app platform, or not everyone's going to want to install an app on their phones. We've got other tools under development. We've got a dashboard that the HR team or the health management team uses to actively monitor the organization. So things like a bunch of people phoning in sick would surface organizationally rather than just within a single team. Today, if you wanted to know who was sick, you'd probably have to call the payroll department in most organizations, right? That doesn't work very well in terms of managing disease. Using policies, so utilizing the community policy, the regional policy from health authorities and federal governments to engage how employees treat their health situation vis-a-vis work. And then deploying a light amount of artificial intelligence to create some real-time decision support, so that if a person passes a few different gates in the daily check-in, maybe the AI decides, yeah, you should stay home, you should take 2 sick days or work from home day. And then, of course, we have to bake in a lot of privacy and security in order to protect people's data. There's a HIPAA compliance thing in the United States. A lot of the rules from provincial health authorities in Canada are quite similar to HIPAA, so we use that as a guideline. And these are all things that companies, organizations today can't do on their own. And so we're trying to fill that gap. We got another lag here. I'm a really big fan of Google Slides, you can tell. Oh yeah, of course, didn't work. So yeah, a quick demo of what the dashboard looks like. So you know, we're showing here how many employees have actually taken up the software since it was deployed. We've got health status reports, risk levels, and around specific diseases, we have things like how many people are positive, how many people are high risk, how many people are low risk, things like that, which departments are affected, that sort of stuff. But again, pretty early, and we're looking to have conversations with folks who might be looking for this kind of solution. It's a product that's under development today, and we're learning just like everybody else. we're 100% focused on solving this problem and making illness manageable for organizations. And we're looking for feedback. So my email address is up there. You can follow me on Twitter. I'm just Ian B. And I look forward to hearing from you.
Sounds good. Thank you so much, Ian. This looks really promising. And hold on.
Uh-oh. Did you get an illness report?
Can you guys hear me?
Yeah.
Yep.
Give me a thumbs up? Okay. So I got this weird thing with Zoom that sometimes it kicks me off. So I won't be able to hear you. But anyway, it's time to wrap up anyway. So let me just go back to my slides for a second. I wanted to bring up again the contact information. Looks like what you guys are cooking up there seems promising for answering a lot of these questions that we threw out there around privacy, discrimination, etc. So we need tools like this to help us through these things, and it looks really promising. So I'll just say a quick reminder about QT chats coming up. So we're going to be doing one about funding R&D in 2020, some developments in Shred, and things you might want to think about there. And the week after that, we're going to be talking about branding, and a lot of companies are sort of revisiting how they're communicating out with the world and their identity. So we're going to be talking about that. Colin already mentioned 2 events that are coming up, and the links for that are in the chats. And then all that remains to be said is just a big thank you to everyone who joined. Particularly to Ian, thank you so much for coming and sharing all your thinking about privacy, discrimination, safety, technology, on all that, and for Dustin and Colin and everyone who joined and contributed their questions. Thank you so much, and enjoy the rest of your Tuesday.
Thanks so much.
Thank you so much.